The Ministry of Health, together with the implementing partners, have revealed that the country has reached the final stages of eliminating river blindness from the country. Health experts, district officials, and political leaders from affected areas and neighboring countries like the DRC and South Sudan are deliberating on how best the disease can be kicked out of the region.
It is soon, because all the entities must be eliminated by 2030. But Uganda is hoping that within the next 1 or 2 years, for us, we shall have achieved elimination. But elimination is being delayed because for us to achieve and sustain elimination, Congo, which is just across the border, and South Sudan should also have moved closer to elimination, because people move from either side so they can reunite or initiate another transmission site, because the flies are still here.
But we are not fully done yet. We have the urgencies, sleeping sickness still with us, and we also need to walk the talk and move on from elimination as a public health problem to transmission reduction. This is very important. These are the two good news I want to bring to you. And also, again, for the main reason why we are here, we celebrate the progress we have made in this regard. Onchocerciasis is one of the major issues. For Uganda, we are almost there.
Health officials noted that Uganda managed to reduce on the spread of the disease by eradicating the black fly and also intensifying mass distribution of medicine drugs that fasten the progress towards elimination of the disease.
And long-term distribution of the drug over and over again results in interruption of transmission and eventual elimination of the disease. And now we've made really substantial progress here in Uganda, particularly as a result of the program that we're talking about here, that my committee oversees in terms of the Scientific Advisory Committee. 15 out of the 17 foci that we had originally here in Uganda, we no longer have any transmission at all in those foci, so the people no longer have to even worry about this. This is a disease of the past.
There remain 2 foci that still remain in need of mass drug administration. These areas have received treatment for many years now, but are not yet to the point where we can safely stop treatment. And so we need to continue to enhance our interventions, to mobilize the communities, raise awareness within the communities about the devastating effects of this disease. This disease is one of the leading causes of preventable blindness globally.
Globally, approximately 18 million people are infected, 1 million are visually impaired, and more than 350,000 have been blinded by the infection. Approximately 95% of all the infected people live in Africa, and about 1.36 million people in Uganda are infected, and 1.8 million people are at the risk. Black fly is responsible for about 80% of the river blindness transmission in Uganda. Zahara Abigaba, UBC News.